Well, it is the working poor who often suffer the most from the lack of health insurance, and few people have seen exactly how that plays out any more than the Oklahoman in our next story. Doug Cox is an emergency room physician as well as a Republican state senator. And it is those two roles that has put the good doctor at odds with his own party when it comes to our state's approach to federal health care reform.
Roe v. R, go ahead.
When accidents happen and minutes matter, access to emergency health care can be the difference between life and death. Inside these doors at the Integris Hospital in Grove, Oklahoma, emergency room physician Doug Cox has seen it all.
You know, I've seen a dramatic change. First of all, there's been a huge increase in volume. Secondly, primarily we used to see emergencies, things such as strokes, heart attacks, cuts that needed to be sewn up, sutured, broken bones. It was truly an emergency room.
So you got T-boned?
Now probably 90% of what we see in the emergency room is not a true emergency. It's everything from a toothache to a common cold, 90% of which could be handled in a private physician's office, a family medicine or an internal medicine's office.
Why do you think that is?
Well, I think there's two reasons, and that's what kind of keeps me grounded working in the ER. We deal with real life and real life situations, and we see people in the emergency room who have a primary care physician. They've tried to get into that doctor's office, but they say, well, our first opening is in 3 weeks. I think that's an indication of the physician shortage in Oklahoma. It's statewide, it's nationwide, but it's a little bit worse in Oklahoma than it is in most states, and it's worse in rural areas such as Delaware County, Grove, Jay, my surrounding area.
Increasingly, family practices in rural Oklahoma are getting fewer and further apart. And with 1 in 5 Oklahomans currently without health insurance, emergency rooms like Cox's are often their only option.
Now, one thing about the emergency room is we treat all comers. To me, it's comforting, it's reassuring, it's what America is about, to know that regardless of your socioeconomic status, you're going to get the same great care in this emergency room, whether you're a millionaire or a pauper. Unfortunately, the mindset of many people is that it's only the slackers, the people who are too lazy to work, that need help and don't have insurance. The reality of it that we see every day here in the emergency room, it's people who work, but they have lower paid jobs and they work for companies that are small, and the companies can't afford to provide health care. The cost for a company to provide a family insurance policy is right about $15,000 a year for them to provide insurance for their employee and their family. Many small companies can't afford that. So contrary to popular belief, it is hardworking, tax-paying Oklahomans that can't afford health care insurance. Unfortunately, I see it every day here, that a couple of things. Number one, someone may come in here and they've gone to a physician, got treatment, got an appropriate medication, can't afford to buy the medicine. They don't have insurance to help them with their pharmacy bill. So it's a tough situation.
And oftentimes may find themselves right back in here for expensive care?
That's true, and the emergency room is the most expensive place to get care. And I may surprise you by saying this, but as an ER physician, I know it's not the best place to get care for chronic problems such as high blood pressure, emphysema, because if you come in here 10 times, you may see 10 different emergency room physicians. There's just no continuity of care. Take some deep breaths for me.
And it's that lack of continuity that often can lessen healthcare outcomes while increasing healthcare costs.
Continuity of care and having what we call a medical home, a primary care doctor, has been shown to improve quality, because you know that doctor, he knows you. He gets to know not only you as a person, but you and your diseases and your family situation, and is just able to provide better, more comprehensive care.
And Cox worries Oklahoma's reluctance to fully take part in the Affordable Care Act, or ACA, could make the current doctor shortage in rural Oklahoma even worse. That's because the ACA is funded in part by a cut in Medicare reimbursement dollars that goes to hospitals and physicians.
Well, if we continue to experience the lower reimbursement that's designed to help pay for the ACA without experiencing the increase in payments by the Medicaid expansion, we certainly can't afford it. It's going to put a crimp in already cash-strapped, particularly rural hospitals.
So is it fair to say that in this instance, the rhetoric and the heat of the politics has maybe gotten in the way?
Well, I think so. I mean, especially the argument of, hey, we don't want to take any of those nasty federal dollars. Well, look around. We took them for disaster aid, as we should have. We take them for roads and bridges. We take them for education. If you look at our state budget, a huge chunk of it is made up by federal matching dollars. Those are a return of our dollars that we as hardworking Oklahomans send to the federal government in the form of federal taxes. The program is set up for us to reap some of the benefits of those by returning to Oklahoma, and yet the political rhetoric has tended to put blinders on people when it comes to health care.
Yeah, and so maybe we're just not being honest with ourselves, whether it be at the Capitol or on Main Street.
Well, I think that's true. And you know, that's one of the things that working in the ER keeps me grounded. I deal with real life situations here. And people who come in here, they're more worried about their ability to, if not get good care for them, they want to make sure their children get good care.
And it is Oklahoma's youth that Cox and others believe may offer the best solution to Oklahoma's rural doctor shortage.
The quicker you expose a young person to the career of medicine and how rewarding it can be, the more likely they are to go into it. I think it's important to start talking to kids in junior high school about the rewards of a medical or science career.
We could talk about ethics all day long.
That's why at Coweta High School, FFA students are learning about more than agriculture. Bailey Diffie is among the first FFA students in Oklahoma, recruited while still in high school to consider a career as a rural physician.
I've always wanted to be in the medical field, but I never knew what I wanted to do. And then talking to Dr. Schrum helped me out a lot.
Dr. Casey Schrum is the Dean and Provost at the Center for Health Sciences at OSU Tulsa.
We have to look at doing things differently than what we've done in the past. Medical schools have typically, reached out to college students and encouraged college students.
And to reduce the shortages, OSU is teaming with FFA to encourage rural high school students to become doctors dedicated to practicing medicine in Oklahoma's smallest communities.
Page 9, where we ended up Friday.
According to the federal government, all but 5 of the state's 77 counties are experiencing a doctor shortage, with 30 of Oklahoma's counties having 10 or fewer doctors of any type.
Well, first of all, we need to train more physicians, and this is not something that we can do quickly, because if we were to double the size of the medical schools today, it's actually 7 years before that first physician can open up an office or go into practice. It takes a minimum of 7 years to train a physician, so it's not something we can change overnight.
Just over 1,000 students are enrolled in Oklahoma's 2 university-run and state-funded medical schools.
Herniation.
Med students who, upon graduation, will then apply for a 3 to 7 year residency, depending upon their chosen specialization.
We know that most physicians will stay within 100 miles of where they do a residency program. So we have to fund residency programs in this state. It does no good to train more medical students if we don't have the residencies to keep them in this state.
A competition that also exists between urban and rural settings. That's why the Oklahoma legislature established a fund to create residency programs in rural areas.
Durant, Enid, and Tahlequah are established, and we're trying to get Lawton started up for western Oklahoma.
For the first 2 years of medical school, doctors like Charity Holder live and train in Tulsa at the OSU Health Sciences Center.
But now I'm thinking that it's more likely related to the incision.
But for the next 5 years, they train in rural hospitals. Dr. Holder says the program gives participants more hands-on experience than a typical big city training hospital would.
I talked to some of my colleagues up at OSU, and they said that on their OB month, they only got to deliver 2 babies, and they technically didn't get to deliver them, they just assisted. Well, my classmates and I that went down to Durant and Amanda Reed and Tahlequah, our comparison charts, we were delivering 30 babies a month. you know, we were catching them. We actually got to do all the procedures. We were first assist, whereas third-year residents didn't get to be an assist. We got to first assist on all these really awesome procedures. We were in surgeries all the time.
And when Holder finishes her residency, she plans to practice in her hometown of Colgate.
It's one of the things that the Affordable Care Act does. It values primary care, family medicine, and creates a little higher reimbursement for those primary care specialties to encourage more people to get out where the rubber meets the road in taking care of people in areas where they first become sick and enter the medical system.
Any fever chills?
But most believe the success of healthcare reform will ultimately be determined not by doctors, insurance companies, or even Washington, but by patients. Healthier habits don't take an act of Congress. 19% of us still smoke. A third of Americans are obese, and another third are overweight. It's controllable diseases like diabetes, heart attacks, high blood pressure that are the real killers and propel healthcare costs into the stratosphere. And it's controlling those costs that will ultimately make the real difference.